Good evening. Good evening po sa lahat. Wait lang. Okay, continuation po tayo. Tongue diagnosis made easy. Topic natin, swollen tongue body, part 3. Okay, first we have a female, 39 years old. Yung tongue po niya, kung i-observe natin ng mabuti, very pale, swollen. There is a slight teeth marks. So, titingnan po natin yung sides. Meron siyang teeth marks. This indicates that spleen yang deficiency, meron siyang spleen yang deficiency, which is the accumulation of dampness. Meron siyang white coating in the center, dito po sa gitna, which indicates that there is accumulation of cold dampness in the stomach. Next, there is a depression at the root. So, tingnan po natin yung pinakalikod ng tongue. Meron siyang depression, which indicates that there is an essence deficiency. Ang symptoms ng patient, meron siyang exhaustion, fatigue, inability to fall asleep, epigastric pain with emotional stress, wala siyang appetite, there is an intense feeling of cold. Sa Western diagnosis, no findings except underweight. And sa background to disease, there is a chronic overwork, meron siyang work at night, there is irregular eating habits, excessive consumption of raw foods. There is infection of viral meningitis 2 years ago. Okay po. So next patient, we have a male, 28 years old. Observe po natin yung tongue. There is pale, swollen, and big, which indicates that there is a spleen deficiency with accumulation of dampness. Ang coating without root, so check po natin. This indicates that there is a stomach chi and slight stomach kin deficiency. There is also a depression at the root. Ito po, sa may likod ng tongue, may depression, which indicates that there is a slight deficiency of essence. Ang symptom ng patient, there is exhaustion, restlessness, epigastric fullness after eating, there is belching, heartburn, and meron siyang loose stools. There is no Western diagnosis. Yung background to disease, there is excessive sexual activity, meron siyang irregular eating habits, and overwork. Okay? So next patient natin is a female, 37 years old. Observe po natin yung tongue na mabuti. There is a slight pale, swollen po siya, and meron siyang teeth marks. Okay? This indicates that there is a spleen chi deficiency or liver blood deficiency. Meron ding narrow on both sides and drawn in. Ito po, magkabila sa may mga gilid ng tongue, which indicates that there is a liver chi constraint, possibly blood stasis. Ang symptom ng patient, there is pain in the left thigh and shoulder. There's migraine with sensitivity to light during menstruation. Sa Western diagnosis, there is an organized hematoma in the thigh. Sa background to disease, ang patient is overworked. May side effect of contraceptive pill. Ang next patient natin is a female, 28 years old. Ang tongue po niya, observe po natin mabuti, slight pale and swollen. So this indicates that there is a spleen chi deficiency, liver blood deficiency. Ang tongue din niya is drawn in on both sides. So kung titingnan mabuti, yung gitna po, medyo may papasok, which indicates that there is lack of nourishment of sinews and tendons due to chi and blood deficiency. Okay? So sa symptoms, there is pain in the right arm and shoulders. There is tingling and numbness of the thumb. May muscular tension. May ringing noise in the right ear. Sa Western diagnosis, there is a brachial plexus neuropathy. Sa background to disease, meron siyang whiplash. Okay po? Next patient, we have a female, 50 years old. Ang tongue po ng patient is pale red, slightly swollen. So this one indicates that there is a spleen chi deficiency, which is accumulation of dampness. Kung observe po natin mabuti, one half of the tongue is swollen. It's sa may kabilang isang side. Midline shift. So nag-move po yung midline, which indicates that there is lack of nourishment in the channels and collaterals due to qi and blood deficiency. So ang tongue din niya is thin, wet coating, medyo thin and wet coating, which indicates that there is accumulation of dampness. Ang symptom ng patient, there is morning stiffness, joint pain upon exertion, pulling sensation and weakness in the left thigh. There is a spasm in the calves upon exertion, and meron siyang exhaustion. Sa Western diagnosis, ang patient natin merong multiple degenerative joint disease. Okay po? Sa background to disease, injuries due to a car accident 2 years ago, and the patient is overworked. Okay? Next patient, we have a female, 28 years old. Ang tongue po ng patient, kung observe natin mabuti, is slightly red and swollen, which indicates that there is accumulation of damp heat. There is also a peeled coating. Kung observe po natin, meron siyang mga areas na natatanggal yung coating, especially in the anterior and posterior thirds. So, harap and likod, merong mga peeled coating, which indicates that there is a stomach yin deficiency, lack of communication between heart and kidney. There is also a white, slightly greasy, thin coating in the center. Okay, tingnan po natin dito sa may center ng tongue, which indicates that there is a blockage of stomach qi by damp turbidity. Ang symptom ng patient, there is a panic attack with tachycardia and pain in the chest. There is also inability to fall asleep, fatigue, fits of rage, feeling of heaviness in the body. Sa Western diagnosis, meron siyang cardiac neurosis. Sa background to disease, excessive anger and frustration, and unsatisfactory emotional relationship. There is also excessive consumption of sweets. Okay po? So, we have yung case ng cardiac neurosis. This 28-year-old beautician was known for her rash, loud, boisterous, and inconsiderate behavior. For 3 years, she had suffered from a heart neurosis and sleeping problems. Her panic attack occurred mostly at night. There is tachycardia and pain in the chest connected with a strong feeling of fright. Had her husband calling for an ambulance on many occasions. Conventional medical findings, she was unhappy and dissatisfied with herself. In general, she was very aggressive, talked loudly, and appeared restless. The appearance of her panic attacks coincides with the complete disappearance of her sex drive. In her spare time, she sat in front of the television and ate sweets. While her menstrual cycle was regular, her periods were very heavy. The tongue was reddish and slightly swollen. The tongue coating appeared peeled, and her pulse was rapid and thin. Sa analysis, although the tongue body was swollen and of reddish color, it was the large areas of peeled coating that was suggested the onset of kidney weakness. Okay? The coating was specially peeled in the anterior and posterior thirds of the tongue, which is indicative of heart and kidney dysfunction. The history did not clearly show the reason for deficiency. However, in my opinion, sabi ng author, it was due to her strong fears about life. that she would become homeless or that her husband would leave her. Okay? So marami siyang iniisip na ganun. The panic attack started in a phase of her life when she lived alone for the first time. So nagkaroon siya ng panic attack nung nag-iisa po siya. She felt very lost and lonely at this time and did not cope well with being on her own. Okay? The field coating reflect quite clearly the location of the energetic disharmony. So, nalolocate po yung disharmony through the reflection of field coating. That is the failure of fire and water to communicate harmoniously. Okay? The kidney yin was not nourishing the heart yin sufficiently. So, yun po yung nangyayari. Yung kidney yin na dapat magno-nourish ng heart yin, hindi po nagawa ng kidney yin. The ensuing fire from deficiency in the heart gave rise to the panic attacks. So, yun po yung nangyari sa heart. Inner restlessness and sleeping problems. So, meron siyang panic attack, inner restlessness, and sleeping problem because of the deficiency in the heart. The profuse menstrual bleeding contribute to the blood deficiency which also affect the heart. So, dahil po dun sa menstrual bleeding, nakadagdag pa po dun sa or condition ng patient. The profuse menstrual bleeding also weakened the liver blood. Her inability to fall asleep and her unbalanced emotion may be due to insufficient anchoring of the ethereal soul, yung hun, by the liver blood. Okay? Na dapat po ma-anchor. Okay? The swollen tongue indicates an accumulation of dampness in the interior. This may have been caused by the overconsumption of sweet, sticky foods. The slight greasy coating in the center of the tongue indicates an accumulation of turbid dampness in the middle burner, which is related to her inappropriate diet. Okay, so observe po natin kung may na-observe tayong ganitong tongue. There is an effect sa mga sweet food or damp food na pwedeng ng condition ng patient. So kung observe po natin dito yung first picture, then after treatment, nag-improve po yung shape ng tongue. Okay? So sa treatment was directed at restoring communication between the heart and kidneys, calming the spirit, and nourishing the blood. Simultaneously with the treatments which lasted 4 months, so ganun katagal ang pag-treat nitong case ng patient, umabot ng 4 months, the patient started to practice qigong. So meron din siyang qigong na exercises. There is a acupuncture treatment were given weekly for 8 weeks. So weekly for 8 weeks ang treatment ng acupuncture, followed by treatments at 2-week, then 4-week intervals. So as the patient improves, reduce po yung intervals ng treatment. As a rule, not more than 4 acupuncture points were used in each treatment. So hindi daw sumobra ng 4 acupuncture points ang ginagamit per treatment. So there is 2 sets of points were used quite frequently. The first set consisted of, so yung points, meron siyang heart 7, which is ang needling technique, draining, ang CV15, which is neutral, and yung kidney 4, ang ginawa ko is tonification. So this one is the first set of points. Yung second set, naggamit po ng TC6 and neutral po siya, and liver 8 ng nag-tonify, and kidney 3 tonification din. After 4 months of treatment, the patient felt well. Okay, nag-improve na po siya after 4 months of treatment. She became noticeably quieter, more relaxed, and more pleasantly mannered. She has not had any panic attacks for 2 months. In addition, the tongue lost its field coating. So nawala po yung field coating, although the tongue body is still slightly swollen and a reddish color. To stabilize that communication between the heart and kidneys, the prepared medicine Emperor of Heaven's special pill to tonify